My name is Dr. Jacqueline Kitulu. I'm a general practitioner for the last 24 years. I have today partnered with Ponea Health on this educational video on diabetes mellitus. So next we'll go on to what are the complications of diabetes. And many times we do have complications because the illness has not been treated adequately. So the complications of diabetes, usually when I discuss this with my patients, I tell them the complications start right from the top of your head all the way down to your last toe. So if we start from the top in the brain, diabetics have a higher risk of stroke. So that's one of the complications of poorly managed or inadequately treated diabetes, that they are at a high risk of stroke. If we move to the eyes, diabetics, and indeed you'll find many diabetics saying, one of the things that made them realize there was something wrong was that they couldn't see very well. So remember that the blood glucose goes and sits in places where it shouldn't be and becomes toxic in those areas. So one of the places it will affect is the eyes, and you'll find that there'll be poor vision for diabetics who are not well treated. The good news is that at least that is very easily reversible. When the blood sugars are well managed, then the vision pretty much gets back on track. But there are patients who will have long-term eye complications because of long-term raised blood sugars. Then let's move down towards the heart. What happens at the heart level? Patients who have diabetes have a higher risk for heart attack. You are equivalent to a patient who has had a stroke or a heart attack just by the fact that you have diabetes. But diabetes patients, we know, then are at a higher risk of a heart attack. So that's on the heart level. If we move further down to the kidneys, kidney failure, we have, in terms of the number 1 and 2 areas of risk factors for kidney failure, and I'm sure you've seen patients who are on dialysis, it is diabetes. So diabetes, that high blood sugar goes at the kidney level and destroys the kidney, makes it porous, makes it leak protein, and just destroys its function. So poorly managed diabetes leads to renal complications, which can lead to what we call chronic kidney disease and eventually kidney failure. Let's move a little further down. In terms of males, what happens in men with poorly controlled diabetes? They may suffer erectile dysfunction. And this is indeed one big area that brings a challenge, because the patients they don't even think of that risk factor, and hence the importance of ensuring that the diabetes is very well controlled. Moving a little further, let's move to the legs. What happens in the lower limbs and usually the feet? And I'm sure you've had the term diabetic foot. So what happens, and this is, the sensations are felt more in the feet, but they can be elsewhere, something we refer to as diabetic neuropathy. And in diabetic neuropathy, what happens is that the high blood sugar actually is very toxic to the nerve endings, and the nerve endings get irritated, so that the patient then begins to experience what you may have referred to like burning sensation of their feet, so that even when they step down, it's like they are on fire. Now, beyond that burning sensation, others will end up with zero sensation, that it goes to a point where they lose actual sensation in their feet, so that when they are exposed to injuries or burns, they are not even aware of those injuries. Now, when they develop those injuries, be it a wound, be it a burn, and they are not aware, it can continue to develop and get worse. And that is where you'll have patients who sometimes we end up amputating their legs because they had wounds that went and, progressed, enlarged, and literally, ate up the whole foot. And they were not aware that this was happening because of, not being aware that that's a complication of diabetes. So that is why I was talking about in the care of the diabetic, like foot care is a very critical item, that a patient needs to ensure that they inspect their feet, look at them, ensure they wear correctly fitting shoes which won't create pressure areas. If there are wounds, that they are treated very quickly, because sometimes they may not be aware of them. Indeed, how many of us look at our feet in that much detail? So for a diabetic, very critical. Those are some of the complications of diabetes. So thank you very much for having joined in this series, listening to hypertension and diabetes. It has been my pleasure empowering you to manage your hypertension or diabetes at home. You can reach me through ponea.com for my services for managing your hypertension or diabetes. Carry on.